Um, Thanks everyone for being here. My name's Katie Colhoun. I'm the Director of Community Resources and Advocacy at Ocean Partnership. Caitlin, did you want to introduce yourself?
Hi, everyone. My name is Caitlin Lord. I'm the Community Resource and Social Media Specialist, also here at OPC.
I guess we could introduce one another just to get to know one another. Donna, did you want to go next?
Sure, I'm Donna Carlson. I'm the Chief Operating Officer of Oceans Harbor House.
And Dawn?
I'm Dawn Smaritano, the Chief Financial Officer of Oceans Harbor House.
Okay, we have Erin.
Hello, good afternoon. I am Erin Klein. I'm the Senior Program Director at Ascenda. I'm here with the Oasis Family Success Center.
Great, thank you. Kara?
Hi, I'm Kara. I'm from Bright Harbor Healthcare.
Oh, okay. And then last but not least, is it Heidi? I'm going by your name on the screen.
Can't hear anything.
All right. Well, we'll get going. Let me share my screen. All right. So, and Caitlin, you can let people in, right?
Yep.
All right.
I'll manage that.
All right. Thank you. So, this year's, it's not really this year. So our fiscal year runs from July to June. So that's why the dates are kind of wonky. So this request for proposals is really for our next fiscal year, beginning July 1st, 2026. It's pretty broad. It hasn't really changed too much over the years. It's really broad so that we can get a variety of proposals and address the many gaps in services in Ocean County. So the whole point of the funding is to promote and develop new, additional, and unique resources to address any unmet needs or underserved needs in Ocean County. The max, the entire grant is at $67,697. It can fund one or more projects, so we could break it up. It could be just the whole lump sum. It really just depends on the proposals that we get and what the proposal review team decides and recommends. It's not that much money overall, so quite often it goes to one program, but it really just depends on what the team decides. Whatever programs are developed should be geared towards the youth that we serve in the children's system of care in Ocean County. So that's any youth experience emotional, behavioral, developmental, intellectual, and substance use needs. It is not just designated for kids enrolled with CMO or mobile response. It can be for any youth in the community. But of course, the kids that we serve, it should meet their needs at CMO mobile response. So the application, we can go through I'll just go through these due dates since they're up. So like I said, the funding, the project is intended to be implemented by July 1st, 2026. That said, we don't always get the funding right away. We only got our funding for this year's that was supposed to start in July this past month. So we are flexible with that start date, given when the funding comes in. Sometimes the programs are supposed to start in fall. Some of them start in, it's all different times. So although it says that, we are flexible with that date. Obviously, October 20th was when this RFP was issued. Mid-bidders meetings today. Thank you all for being here. The RFPs are due to OPC Friday, December 19th by 12 p.m. I do ask that if you do, that they're submitted via email. Short, sweet, to the point is best. It could be a Word document, PDF, whichever works best. We'll go through the application too, but make sure that first page is filled out. I'll walk through that. On January 8th, this is a Thursday at 2. We do have the RFP proposal, the proposal presentation scheduled. So before doing all of that, we have our proposal review team rate the proposals. And from that, we'll pick like the top 3-4 proposals to present. The proposals are vetted, of course, that they meet the criteria. And then, like I said, we pick the top 3 or 4. Otherwise, we have been there for hours in the past, and it just doesn't really make much sense. Proposals are picked on ratings, so that's why we picked the top ones. Let me see. That will be virtual as well. And, as the time comes up, I will inform whoever is picked to present and provide more information.
A separate line item.
So we then, once we pick the proposal or proposals that are, that the rating team chooses, we do send them over to Children's System of Care. We have to do that by February 13th. And then they go through their review process. So we recommend the proposals to the state, and they make the ultimate decision whether or not it's funded. So once we make those recommendations, we try to make sure that all the state protocol, all of that is followed, the guidelines, so that we're not, sending them something that would probably be denied. And this part of the presentation today, the bidders conference or information session. So we'll go over a lot of that. And then CSOC should let us know, Children's System of Care, by May 15th, whether or not the funding is approved. In between February and May, there can be a lot of back and forth between Children's System of Care and us. If they have questions about the proposals, they want modifications. So there's a good chance, if your proposal is recommended, that there may be some back and forth. And, we manage that as it comes. All right, let's open up the application. So we went over the top part. So we also put in this RFP, some areas that are gaps in services and are needs that are not filled in Ocean County. By no means, there are also at the end a list of all different kinds of data. If you find other needs in the community that aren't listed here, by all means, you can submit a proposal. But these are recommended areas that we see that there is a need. It's a lot, obviously, and they're pretty general. Of course, intellectual developmental disabilities, a neurodiverse community, there's a lot of gaps in services there, as we all know. Behavioral health services for kids under 10 are very hard to come by. There's not many therapists that can serve them, whether it be in-home or outpatient. So there's always a need there. Obviously, acute mental health needs, we do struggle with the agencies, the community. We don't have many providers that can meet those needs, aside from like going to psychiatric emergency screening or inpatient. We do see kids, a handful with first episode psychosis, a lot of suicide ideation right now. We're seeing a lot of that. Also, acute mental health needs and the kids with IDD needs. There is that dual diagnosis, and there's really nowhere for these kids to go when their needs are super high. And they kind of just revolve in and out of emergency rooms. So trying to figure out how to meet that need would be amazing. Obviously, social determinants of health, and that's a big deal right now with all the, all the pending cuts going on from the feds. The state's trying to absorb that, but for how long can that go? Obviously, housing continues to be a need. Early education, childcare, food. Anyone with a minority status now, there are definitely struggles. That can, if there's creative programs to meet these, we welcome that. integrated health programs, specialized childcare. I know I mentioned childcare, but young ones, especially preschool, that have behavioral health needs, they don't tend to succeed in preschools. Thankfully, a lot of the preschools, there are the lotteries in the public school districts that seem to manage that. So that's a good thing. That's been evolution, but maybe in those towns that don't have that option. There's always a need for Spanish-speaking providers, services, groups. There are not enough to meet the need in the community at all. Anything that addresses ACEs, eating disorders, we don't have many providers that do that in the community. Supportive parenting, just helping parents, get their needs met, because raising kids with behavioral health needs, any kind of, it's a lot for them. And then services for youth 18 and older that are aging out of the children's system of care, especially housing, independent living skills, vocational. All that said, they're pretty broad, but I'd like to say it covers all the needs in the community, but it may not. And so, like I said, it's the proposals or the programs do not have to be pigeonholed to those, but those are definite needs in the community. So like I said, there's also on page 11, needs assessments and data sources that we did pull from to come up with these, areas. We also know it just because we do the work. So feel free to review them. You should be citing them when you're going through the needs statement. It's not just something made up, but that you're citing the data sources, needs assessments. And you're not limited to those specific needs assessments and data sources in Appendix 3. If you find other ones, you're more than welcome to use them, as long as they're legit. So just want to make sure I'm covering all that. Sure. All right, so we went through the RFP dates, and like I said, at the end of the day, Children's System of Care makes the final decision. And it also is contingent on the availability of funding. At this point, the funding it should be available. They put out the RFP. We assume it will be, but there are so many, things going on right now with the federal government, the state government, the budgets. You never know. So I'd hate to say it, but it's never a guarantee. So just keep that in mind. We hope it does. I think there's only been one time that the RFP went out and then they called it. They said they couldn't do it. And I think that was like 2008, 2009 when there was like a budget crisis. So I think that's why that happened. We're doing the bidders meeting now. We went over the submission deadline again by 12 p.m. Friday, December 19th. I do appreciate if you text or call and let me know that you sent it via email. There have been instances where people have sent it and I haven't got it. So I don't want, just to confirm that I did receive it. Okay, we'll go through. We talked about the proposal review meeting. Just so you know, the proposal review team consists of members of OPC staff, Caitlin and I, for instance, some of our clinical folks. We also have, if mobile response, as long as, there's not a conflict of interest, like preferred is submitting a proposal, they'll sit in, kayak, DCPP. So they're all invited. We do have a board member that sits in. So there's probably like 8 to 10 of us that do the proposal reviews. And what that looks like, obviously everyone gets them. We review them. And I'm just going to go through and we'll skip back to, we review the proposals based on this rating scale. And, so really pay close attention to the rating scale to make sure all these checks are included. And I'm sorry, I'm watching my neighbor's dog and this thing doesn't stop barking. It's a little Toto dog, so it looks real cute, but it gets on my last nerve. Anyway, I'm sorry. I think she barks at the leaves and the wind and like the birds that are everywhere. So anyway, going back, make sure that the proposals do answer these questions, that everything's covered. They are, different points here. So pay attention to that. But going back to the application, this is what I was talking about. Make sure at the top of the application, you do have this information, name of organization, mailing address, just to keep it clear. I know it seems silly to say, but sometimes people don't include that. Sometimes it's those obvious things we forget. I'm guilty of that. So the needs statement, just make sure again that you're hitting all these bullet points and comparing it back to the rating scale. They are parallel for the most part, but there's, just make sure both are covered. And like I said, important to cite data sources regarding the needs. Description of the agency and history of services to youth and families. While we're not opposed to funding new agencies or programs, it does help to have a history of service, that there is experience. So if it's a newer agencies, the people that are starting the agency may have that history, that may have that experience. So just make sure to include that. Obviously, the description of services, be very clear. This is the program that we're proposing, and then breaking it down, not overcomplicating it. I always say short and sweet, simple to the point, it is the best. There needs to be an implementation plan over the fund. Like what's it going to look like to implement the program? You don't have to get really dates. It doesn't have to be very specific, but what that would look like, maybe it's the summer we hire, the fall we begin, we plan to open. So it can be very, general and flexible, because like I said, depending on the funding, when we get the funding could determine when you get the funding. But if a program needs to start in the fall, we'll figure it out. Where was I at? It also speaks to best practices, promising practices, and evidence-based practices. Those are ideal, great, usually very expensive programs. So they don't have to be, but it is, it does help that there is at least a best practice, promising practice included in the programming. Again, background, qualifications, and justifications of organization to do the work. It can't just be anyone, people with experience in history. Please make sure to include that you agree to serve Medicaid eligible youth and families. It cannot be a Medicaid funded program that you're proposing or trying to create, which, that it can't be a duplicate of any Medicaid program or any children's system of care program. But there's also, make sure to include agreement to serve all eligible New Jersey children's system of care youth. There's no eject, no reject, as they say, of the kids that we serve. They have to be able to be served. And the time period of services or activity. Usually it's a year, but it really depends on the program. Sometimes they go longer. I mean, ideally they can sustain and keep going after the funding runs out, but sometimes they are shorter. One year we funded the sensory beds, garden beds for Field of Dreams. Obviously they weren't doing that all year because, there's seasons and the plants don't last all year. But it just, just make sure that, especially I guess when you do the budget, just keeping in mind like how long the money's gonna last, especially if a program is looking to serve a certain amount of kids. That may not last. It's only 70 grand. So just a time frame. Again, we are flexible and understanding not everything's going to happen as planned. Anticipated outcomes. So how many youth are planned to be served, or how many, something quantifiable, smart, and that there is a sustainability plan. And a lot of times it's tough when the program can't bill insurance or can't bill Medicaid, or, there's not, a lot of times it's just that you can prove you have a fundraising history or successful grant writing program. So it depends, just keep that in mind, how you plan to sustain it or hope to sustain it. Like I said, quantifiable deliverables. So how many kids, usually that means you plan to serve For how long, it really, again, depends on the program. Fiscal program. Okay, but there's again, bidders must demonstrate a reasonable plan that outlines relevant strategies to pursue funding after the grant period. Again, it could just be things that you have done in the past that have been successful. That's a tough one. We understand that. So do your best there. And we understand there's limitations and the reality of funding and all of that. But like I had also mentioned, it can't be a Medicaid funded program. The Children's System of Care is not okay with that, even if it's just a start-up one. Same thing if it could be insurance can pay for it, they're not going to be okay with that. They want stuff that are, that does not already exist, not a duplicate of services. Strong affiliations with larger, well-established community resources can be provided as a source of sustainability too, so that you have partnerships in the community, maybe ways to partner down the road or plans to continue the service. Evaluation methods. Obviously, this is around the success of the program. Are you going to do pre and post surveys? Are you going to do a variety of different ways of evaluating that you plan to serve X amount of kids and those many kids did attend. And then quality assurance is important too. How do you plan to ensure quality, whether it's, there's all different ways to do it depending on what the program looks like. As far as the budget goes, keep it simple. We don't need the whole agency's budget. It is a budget only for this program that in the RFP. So please keep it simple. I keep saying that, simple, right to the point for all of this is definitely appreciated on our end. It doesn't need to be overcomplicated. And make sure your budgets add up. Sometimes that would, that has disqualified some applications when it just doesn't make any sense. So make sure your budget makes sense. And that's why I go back to keep it simple. So these, must be included with the application. Board members, other program funding sources, including any funding from Department of Children and Families. They want to know that. If you're currently applying for CRD funds in another county, Children's System of Care is not okay with that. If you've received Ocean County CRD funds in the past, I'm not sure what CSOC stance is on that, but they want to know. And then there's this whole new carry check attestation form. So what this is new. A lot of our programs are already doing these carry checks. These are the background checks for child abuse registry index is what it means. So there is a form at the bottom. It gets a little wonky, but the Children's System of Care wants, there's a whole instruction and certification form here to review and make sure you understand. This is directly from Children's System of Care, how to register, how to access the system. The timeframes are supposed to be 2 weeks. All agency, anyone in the program administering the program needs to pass the carry check. This form needs to be included. The carry check attestation form needs to include it in the RFP. So I understand that you may not know who's going to be staffing these programs when you're submitting the proposal. It might be based on, you might be hiring people based on whether or not you get the funding. If you already have staff specific that will be administering the program, I get ahead of it and get their carry check done. So when we submit the Children's System of Care, we can submit that carry check. If you don't know, this form needs to be signed either way. The carry check attestation form needs to be signed either way, whether you know which staff are going to be working at the program or not. But like I said, if you do know and they are currently employed with you, just do the carry check and send it in. It's kind of wonky. It's new. If you have any questions about any of it, all you have to do is give me a call, let me know. So I think that concludes everything as far as the proposal review goes. So I'm going to open it up and see if anyone has any questions.
I have a couple quick questions. First,
Sure.
I know you said to email it. Would you rather we drop off a hard copy to you? Since we're right down the
Nope.
street, you want it emailed?
Yep.
Okay. Just
Because I have to send it out to everyone. If they want to print paper, on paper they can, but I like the trees.
Yeah, that's good. And then the other one about the carry forms, like if we had something that we're working on with possibly somebody outside that we would get the carry check on them, does that have to be done before we get accepted if we're not sure if the program's going to go through? Do you know what I mean? We have like our staff
Yeah,
get
well,
the carry check.
that's where it's wonky. So Children's System of Care, like if they have already staff designated to work at the program, we want the carry check to see that they passed. But if you don't know, they're not hired yet, then it just complete that form and we'll work through that piece. Because I said to them, I was like, that's great, but sometimes they don't know who they're hiring, or they're not, so it just, we'll deal with that as it comes.
Yeah, we would know what staff, so we'd be able to
Okay.
obviously include the staff, but there might be one or two people outside of our staff that haven't been hired yet. That was kind of my question.
Okay. Yeah. If you know which staff, send in the check. If not, we'll get to that point as the fun, as if the program's recommended, as I get hired, or however it goes. But before the program they're not going to want anyone working at this program without a carry check. That's the bottom line. Yeah. But I think a lot of us do them anyway. A lot of our agencies. So. Any other questions? All right.
Katie, that means it was so thorough.
Well, I mean, I've been doing this a little bit, so.
Just a few years.
Yeah. If you have any questions at any time, you can always call. If you just want some help with kind of going through, does this make sense? Do you think? Because Children's System of Care has a whole, under like they do have some rules that maybe I forgot, but I think I've gone over them. But there's so many variables with this all because there's such all different programs come through that we'd never think of. So you can't think of all the rules. But I think for them, really, they don't want to see a duplication of any Medicaid programs, any programs that already exist. They want something new that fills the gaps. So do we. Something sustainable. It doesn't have to serve 1 million kids. Obviously, you have 70 grand. They want to see that as much as that money going towards the program as possible. Admin costs should not be that high. I think usually a safe bet is 20% or less. You can include supplies. You can include, there will be, I guess that's good to go over too real quick. If your program is chosen, recommended and funded, there's 3 quarterly, there's 3 reports that would not be quarterly, 3 reports through the year, just an update on service delivery, budget. And then for the first one, they do want a kickoff event. So even if you wanted to include some of the costs of that event in the budget, that's fine too. So, but once people are recommended, funded, we then all work together. So it's not like you're left alone. I'm there. We'll have meetings and we'll figure everything out. So
I think you already answered this as well, but I just want to reiterate. It could be more than a year for this, what we're submitting, like it could, okay.
yeah, it depends. Sometimes,
yeah.
Go ahead.
Like if we weren't to spend it all in 1 year, we could make this like a 2-year thing and it'll
Sure.
be like 2 years. Okay, just a question.
Yeah, I mean, that's good. It's sustaining longer. So that's always a good thing. And it can be shorter because sometimes it goes fast. And some programs, they just couldn't get the traction and they couldn't get the kids in. So it took them longer to spend the money. And then, like I said, we just got the money for the July program now. So they're all obviously a little bit behind, and that's okay. They're not behind. It's not their fault. Just what happened. So
And we are recording this meeting, and we'll be uploading it to our YouTube channel after. So if you want to go back, if you forgot something, if you're like, oh my gosh, I remember she said something about that, but I can't remember, feel free to just visit our YouTube channel. I just dropped it in the chat.
yeah, and I'll add it to our website too on the CRD fund proposal page.
And I will do nothing but add some comic relief every now and then.
Only if you dress the part.
I can dress the part.
Oh yeah,
Jessica won the best dressed at the open arms
She did,
casino
man.
night.
I heard the only flapper.
They were quite the
Wow,
couple,
that's
let me
great.
tell you. Quite the couple.
That's
We walked in
awesome.
with like, I think we're the only ones fully decked out, but we're gonna have some fun with it.
Hi, Tova, you have your hand up.
Yes, hi. I was just wondering, it said in the RFP, like they were looking for help with like specific populations. I was just wondering, I just wanted to make sure I'm clear. Is this program like for something that's, kind of like a wide group, or is it specific for like a niche population or group? Just because, in the past, like some of these grants, it was like for one neighborhood or one community. So I just want to make sure that we're on the same page.
It can be for like one niche as far as like maybe kids with intellectual developmental needs, but it should be open to any kid in the Ocean County. It's not specific to like a neighborhood or a town.
Okay. Okay. So the niche is kind of like the need or the service rather than like, kids in
Yes,
Thames River. Okay. Perfect.
absolutely. And sometimes some areas of the county are going to have different, those specific needs. So it might just happen to be that way. For instance, last year we funded Girls on the Run. It's a social emotional learning group. And they work with specific schools that are have there's an income eligibility for the town. So it's a town-wide, like they're underserved or the poverty in the community. So obviously that's not going to be every town in Ocean Counties, but they're in multiple towns. So it is specific to that school, but it's, addressing a greater need. I don't know if that makes sense. That's clear. But
Yeah,
it can't
yeah.
just be like, we only serve this town because,
Right.
but sometimes it happens to be that's where the need is. If
Okay.
you're talking Spanish speaking community, there's pockets of it there's definite pockets of it throughout Ocean County. So it's just going to end up being that way.
Got it. Thank you.
You're welcome. Right. Any other questions?
So Katie, just to add to that, there's also the practical level. If we're in Manchester Township, chances are children are not traveling from, across the county to get to that program.
Yeah, that's true as
Right.
well.
Okay.
Yes. And I mean, sometimes they do travel based on what the program is, the need.
Yeah.
So, and another important thing, there can be no cost to the families. So this program, the funding has to cover all costs. We cannot charge the families for anything. Or bill their Medicaid or bill their insurance, whatever their insurance is. It could be Medicaid. So
One more question. Do you prefer a new program or something that is already running, but kind of in its early stages? Or it doesn't really matter?
if it doesn't exist and it's unique, if it's pretty new, then I think that'd be fine. But it can't duplicate services that already exist. Is that like if it's just something you're starting a pilot and this funding would be ideal to help get it going, that could work. But if it's something that is like available and exists everywhere, but no. There's so many nuances to it. But like I said, if you have like questions specific about your ideas, we can walk through them. And I could say based on my experience with this current administration and the way they've changed how the funding is, who is eligible, what programs are eligible, I can kind of give you an idea of are they going to be okay with it or not? So I'm open to that as well.
Okay, thanks.
No problem.
And Katie, correct me if I'm wrong, we've funded both scenarios over the years, like a startup group or an outpatient office that was opening up, that they were using the funds to make their space very sensory friendly. Wasn't that when YAP opened up, and then the youth center out in Brick? But we've also helped fund like expansion of current programs.
Yes,
So
but
it's
that's
all
not
very
allowed
dependent.
anymore.
Oh, it's not. I missed that part of the
Nope.
Q&A.
Well, it's new. This is the new administration. So about 3-4 years ago, they got involved, the Children's System of Care, I'd say 4 now, 5. They got involved with this whole CRD fund application process and made more rules. So it's almost harder to get the funding because we have, funded startup for outpatient programs and helping, offices become, like you said, Justin, but those are not allowed. They want the
Gotcha.
money to go to direct services for kids. I can't say whether or not I agree with that because it's limiting, but that's what they want. So that's what we do. At the end of the day, they make the final decision. So we're bound to that. Right. Any other questions? Okay, hearing none. Thanks everyone for being here. And like I said 3 times, if you have any questions, give me a call.
All right,
And,
thank you.
have a great
Thank you
day.
very
Thanks,
much.
everyone.
Thank you.
All right. Bye-bye.